Hello anatomy friends, and welcome to station number 20, where we are just going to get the basics in terms of the deep back muscles. And this is a much more complex region than the detail that we're going into for this course. You can see that we have reflected the latissimus dorsi and the trapezius on both sides. We've even reflected some of the more intermediate level muscles like the rhomboids that we didn't really get into. And then you find that you have a fairly robust still network of muscles associated with the deep back. And they're going to have attachments to ribs if, say, they're in the thoracic region, but most importantly, there's going to be attachments to the vertebral column. These play an important role in terms of allowing for extension and just stability during our bipedal posture. And it gets really difficult to be able to see these in terms of the differences here. I kind of think of, them not going too much further than this level here in terms of these deep back muscles or the erector spinae muscles. You can have a lot of intercostal muscles here. You're going to have some other muscles associated in this region. But when we're talking erector spinae, I kind of just think of them in these general regions right here. And I kind of think of three columns of muscles. You'll have the iliocostalis, which will be the most lateral, the longissimus, that are the intermediate, and the spinalis or semispinalis, depending on where you're located, that are going to be the most medial. So if you've heard the mnemonic I love spaghetti, that tells you from lateral to medial which ones you're going to see. Now, again, they are going to have slightly separate names depending on what region you're in. Are you in the thoracic region or the cervical region? They'll have slightly different names, but for our purposes, I want you to know these basic terms right here as they are associated with the erector spinae muscles. And you can see that there are a lot of tendons in this region. You will have fascia, so it's difficult to kind of differentiate between these. But for our generalization purposes, that's where I wanted you to be at in terms of that. Now, that being said, on a practical setting, it would be really difficult for me to put something maybe like right here and ask you what that is, because it is quite difficult to differentiate between that. So I think conceptually, this is where I really want you to focus on. This is the type of thing that might be more appropriate for a written exam question, but I did want you to at least get an idea looking at a donor in terms of these general locations of these muscles. Okay, thank you for your time and attention here. As always, please feel free to reach out to me with any questions, and let's move on to the next station.